Thank you so much. Thank you, Mark. I wasn't expecting that introduction. I really appreciate the opportunity to be here. Before I was recruited to Los Angeles County USC Medical Center, a child with uncontrolled epilepsy or a first unprovoked seizure was evaluated mainly in the emergency department. There was no urgent consultation answered by a neurologist. Instead, decisions were made by individuals, mainly emergency department physicians, who were trained to stabilize things and move on. Then, that family would desperately try for months and months to get an outpatient pediatric neurology clinic appointment somewhere in their community in East Los Angeles. And the family inevitably would end up back in the hospital setting when their child had yet another breakthrough seizure. Often, eventually that child would end up with a totally nonspecific, meaningless diagnosis of some sort of seizure disorder, be rendered sleepy or drunk on old generation toxic medications, and the family would learn to cope with seizures as a part of daily life. Control of seizures was really not something that was realistic for many of our community members in East Los Angeles. And this is what access looked like in 2007 in East Los Angeles. But I was incredibly naive to think that one doctor could change this dismal reality. Despite working with awesome, wonderful nurses and astute adult epileptologists at USC, I desperately needed more assistance and expertise to help me in the care of kids with seizures. And that's when our program was rewarded with Dr. David Millett's phenomenal expertise in advanced electrodiagnostics. As a Care and Cure Fellow from 2009 through 2012, David began interpreting all of our prolonged pediatric video EEG studies. And working closely with colleagues from the USC Comprehensive Epilepsy Center, David really opened the doors for surgical interventions for both children and adults within the county population. And soon, life-changing surgery started to occur, and the rate increased by 20-fold, and lives were changed, and quality of life was really just metamorphosized. It was amazing for me to see. But more and more patients still needed faster access to good care. So we began to recruit an epileptology fellow each consecutive year thanks to Care and Cure. Dr. Sana Javid joined us in 2012. Dr. Miko Porter joined us in 2013. Dr. Manpreet Multani in 2014, and Dr. Karandav Rai will be joining us next year. So each one of these outstanding young physicians has trained in our pediatric epilepsy clinic, augmenting their knowledge base specifically of childhood seizure syndromes. I'm thrilled that Dr. Porter most recently accepted a faculty position with us at USC, and she's going to continue to take care of community members for years to come. She has roots in South Central Los Angeles. She continues to advocate for the community while really serving as a role model for peers and others. But Care and Cure, your contribution still didn't stop there. Recognizing that many families lacked access to proven, effective, and safe dietary interventions, you donated funds that enabled us to establish a dietary therapy program at Los Angeles County and USC Medical Center. With these funds and educational support from 2012 through 2014, and support from the Charlie Foundation, we recruited and hired our talented dietitian, Ms. Jessica Lowe. Today, the therapeutic impact of special diets are now helping to control seizures better in our community, thanks to Jessica's specialized training and her specific perspective as a nutritionist. Finally, we're still not done. I'm most delighted to announce that Dr. Michelle Van Herdendas, a pediatric epileptologist, which is kind of the highest breed of clinical seizure expertise, who has stellar training and qualifications, joined our efforts just a few months ago on a full-time basis. Michelle brings tremendous expertise, experience, and passion in evaluating and treating children with the most complex forms of epilepsy. And having trained at Children's Hospital Los Angeles like me, USC, and UCLA, Michelle really represents how the Epilepsy Foundation of Greater Los Angeles really unites our most prestigious academic institutions to advance the care of children. Not a lot of organizations can do that, and Care and Cure and Epilepsy Foundation do that every day. So what does care and access look like now in 2004, 7 years later? Today, seizures still occur on a daily basis, unfortunately, and a frightened and confused family might still end up calling the paramedics and bringing their child to our emergency department. Or if they go to their pediatrician's office, we get an e-consult directly from that pediatrician. Dr. Van Hertemdas and I are immediately contacted, and we have a direct conversation with our pediatric colleagues about that child's spells. We can see the child that very hour in the emergency room. We obtain our own history. We conduct our own age-appropriate neurological examination. And all of this is done while doctors are shadowing us and training with us. And we're blessed to have such phenomenal young physicians, thanks to Care and Cure. Appropriate diagnostic tests are ordered, and the child is seen for close follow-up in our clinic, again, by both of us. So this is how things have changed. And once the diagnosis is confirmed, which is not always such a simple task, the child has immensely more therapeutic options than before, including newer generation, better tolerated medications, special diets, neurostimulation devices, and surgical interventions if their seizures prove to be medically resistant. So I hope you can see how the bleak medical landscape in East Los Angeles really has been transformed to a highly capable, comprehensive epilepsy center where decisions are based on expert consensus, not just patchwork in an ER setting. All of these people, everything results from children like Ari and Chloe and countless others facing epilepsy and what they inspire, that we do better as caretakers and advocates for all children experiencing seizures in our community, regardless of what language they speak at home or what insurance their parents could or could not afford. Thank you so much for making this possible. Thank you.